So I'm Dr. Abhay Kumar Singh. Today I'll be talking about acute disease of the middle ear. So as we all know, the bacteria involves a streptococcal pneumonia, Haemophilus influenza, Morozilla catarrhalis, and some gram-negative coliforms. Most common etiologies are eustachian tube dysfunctions, viral rhinitis, then barotrauma, hemotympanum, and then hematogenesis. Most common in children because the eustachian tube is shorter, wider, and more horizontal as compared to adults. You can see the very well demarcation, the connection of eustachian tube with middle ear here. Now, there are few stages of acute suppurative otitis media, and these are stage of tubal occlusion, stage of exudation, stage of suppuration, stage of dissolution, stage of complications. So, the stage of tubal occlusions is when there can be right ear fullness, fever, hearing will be normal or slightly impaired depending upon rapidity of development of hyperemia. You can see here, okay, so this is stage of tubal occlusion. You can see here in this drum, you can see there is a development of hepatitis media happening. Then the stage of exudation and pre-suppuration, it's basically after 12 to 24 hours, the pneumocystis compartment gets filled with fluid. So it is drum is almost bulging, it is about to burst out. The pain will increase, fever will happen, considerable hearing loss may occur, tympanic membrane is red, thickened with loss of landmarks. You can see over here quite bulging drum, okay, almost about to burst out. You can see again here, you can see here again. Okay, and then the stage of suppuration, as the name indicates, the ear is now being perforated by the pressure of the discharge. Okay, so you can see the whole pus in this diagram, absolutely bulging the eardrum. Child will cry excessively, but soon after bursting, the pain may relieve for a while. The stage of complication, if it is not being treated, so what happens as a mechanism is venous stasis, lactic acidosis, dissolution of calcium, softening and decalcification of septa, hypercalcemic changes won't be seen, rather resorption will be seen. Stage of coalescence, if it is still not being treated or very aggressive, the bony erosion may occur in little mastoid cortex involving the venous sinuses, recurrence of otology and low-grade fever may happen, mastoid tenderness may happen, sagging of posterior superior wall of ESC may happen, reservoir sign may happen. You can see a perforation at these patches here, these images. Stage of resolution is extension of infection beyond tympanomastoid compartment result in the stage of complication. Resolution occurs with cessation of otorrhea, closure of perforation, absorption of exudates. You can see the sagging of pinna here. Okay, here you can see. Then again you can see the problems here. Okay, the management is basically antibacterial therapy, analgesics, antipyretics, decongestant. Then, if it is not relieved by that, you can always club it with myrigotamine. Management of stage of suppuration, oral dilating, topical antibiotics, broad spectrum systemic antibiotic, eye locally. Stage of complications, you have to club this procedure with a cortical mastectomy and drainage of pus. Serous separatis media may sometimes happen. Again, the pus will become sterile, but it becomes more persistent. So, the symptomatology is conductive hearing loss, or fullness, autophony. TM appears retracted dull. You can do an impedance and check. IP type C curves may happen sometimes. You can see the air bubbles here. Treatment are antibiotic, analgesic, decongestant, and if it's not treated, myrigotomy. Myrigotomy is an intentional procedure where we basically puncture the eardrum to drain out pus. Indication is secretive otitis media, AOM, aerotitis media, atelectatic ear, and contraindication is intratympanic tumors. Myrigotomy GA is mandated in all cases of ASOM, and it may be used in some older children, adults, and self-correct media. So it basically we are the anterior inferior quadrant and we give a tap there by merry-go-round. Complications sometimes can happen because of myrigotomy, like injury to included joint, facial nerve, nuclear pulse, and the middle ear infection. Ventilation tubes in a long-term cases of serous media, recurrent AOM, Teflon, silicone, and stainless steels are the material used. You can see the myrigotomy being nicely done here. This is the insertion of the Teflon piston. You can see the piston being inserted